Are you experiencing hip, groin, maybe buttock pain or pain right on the side here of our hip? We may have a stretch for you. It's one of the most common stretches we give out in the clinic here. Obviously, this is based on a comprehensive evaluation, but this is one of the most common stretches we give out. We'll give you a couple things that will tell you that maybe this is the right stretch for you. How you doing? My name is Tom Willman, physical therapist from Apex Orthopedic Rehabilitation in Wyckoff, New Jersey. I'm excited to show you some of the things as far as helping your hip start feeling better. So if you've been told you have hip osteoarthritis, you have a possible hip labral tear, you may have a hip flexor tendonitis, greater trochanter bursitis, gluteal tendonitis. If you have some of those things, this stretch actually may help you. Without a formal evaluation, obviously we don't know absolutely. Most people have tightness in the areas in the front of the hip. So the stretch we're going to show you is actually going to cause some stretch in the front of the hip. You may also notice there's a loss of motion, and we're going to show you how to assess this quickly for you. And we want to look if there's a side-to-side difference, and then it gives us a greater chance that this stretch will help us out. Guys, the most important way to really get to the root of the problem, is to be guaranteed, is get a good physical therapy evaluation. If you're in the New York, New Jersey area, you might be able to come by to us at Wyckoff and really get a real hands-on personal evaluation really easy. Just check in the description. There's a website and there's some links. You can call us and text us. Just consider that. So while lying on the floor, you basically want to have it to the point where both your hips, the front of your waist stays on the ground. You want to extend one hip up as high as you can. But you don't want to arch your back, and then follow by doing that on the opposite side. It may be hard to see unless you have someone else watching it, so you can do a video of you doing it. But that's a good guidance. If there's a big difference left to right, the stretch will probably be a greater chance of this stretch helping you out. So as you saw in the video, we have a hip extension on both sides. The idea is that one of the reasons why that motion is limited is that we sit a lot. So all the structures in the front of our hip from sitting like that get shortened. And then it's hard to, and then over time, we're just sitting and driving a lot. We lose a little bit of the ability to extend our hip. And that's why that direction, I feel, is probably why this is one of the more common stretches that I'll show you in a couple moments. The common stretches that we give out in the clinic, and really helps either abolish, reduce, or it just improve the motion of the hip. One of the thoughts about why this stretch works is it's essentially where there's some cartilage within this hip joint, in addition to the structures around that kind of gets a little bit displaced. And by doing this movement, we essentially loosen it. We kind of like cause motion. We'll see a rapid increase in motion just because everything's kind of moved around the right way that causes that joint to kind of extend and move in directions that it was kind of binding. And I give the analogy that, inside this hip joint, it's almost like an old dresser drawer. You're trying to pull it out and it's off for its runners and it's binding. You can't quite get it to move. And all you have to do is just kind of shift it to the side, and that draw goes back and forth very smoothly, okay? And that's what we're trying to find, is that stretch that kind of causes that joint to be in the right axis so it moves smoothly. It's not binding, it's not to one side or the other, causing a binding of the joint. So some people, when you do the stretch, they'll refer to it as a hip flexor stretch or rectus femoris stretch, something of that nature. We're just basically trying to work on hip extension, and that motion is essentially coming here. If the hip is moving this way, that's hip flexion, then hip extension is moving this way. So when we're doing this stretch, we're essentially going to rock forward, and we're going to relax our back. We're actually going to let the back arch and the hip extend. So extension's this way. So you're going to go pressure on and then pressure off. This stretch would never make you feel worse. I mean, you might feel pain at the very end of the motion, but once you get done, pretty rapidly, like in a couple minutes, you're going to feel like, oh, it's not worse, I actually feel better, if it's the right stretch for you. If it actually makes you feel worse and you lose motion at the hip, it's not the right stretch for you, okay? So there's a couple different versions, I'll show you a few right here. So you're gonna essentially rock forward and kind of arch your back like this. Do about 10. And see, was it a positive stretch? You can stand up, move around a little bit, or do a motion that your hip has trouble with. Let's say, if you're running or walking, whatever activity, almost like a functional assessment, try the activity before and after a stretch. That's a good way to say, did it get better or worse or no change? Sometimes it takes a while for this stretch to take place. You're going to do it at least 3 to 5 days before we're sure it's not the right stretch for you. Way to progress this stretch is to take your hands like this, and you want to apply pressure straight forward like this. So you're going to take your palm of your hand, and you're going to push your hip kind of right at your waistline, push it forward so you get a little bit more pressure at the very end, and then release it like that. So pressure on, pressure off, okay? So you're gonna try this 10 to 20 times, about 3 to 5 times a day, okay, roughly. The key is to spread it out throughout the day, okay? As you do that, like I said, it should never make you feel worse. If it's neutral, that's okay too. If it's neutral and doesn't help you for 5 days, probably not the right stretch for you, okay? Another variation of this stretch, which is really powerful, is changing the position of the leg. So our lower leg right here, so this is our hip, this is our lower leg, is straight. What we do sometimes, and this little variation sometimes makes it more comfortable and more effective, is we'll take our leg and we'll rotate it a little bit in like so, do the same version like that, pressure on, pressure off, or we'll do the opposite direction. We'll go out a little bit like this, and we'll do the same stretch, forward and back. I would start with the first traditional one. Just do the straight ahead one, and then add that little extra stretch with your palm right here, pushing straight forward and getting to the very end of the motion so you feel like, oh, can't go any further, and then reduce it. Some people start out, they'll say, I can't get past here. Like, I'm just tight here. And as they do it, it quickly starts loosening up. That's always a good sign if it's the first time you've done it. So if this helps you out, please give us a quick like. If you have a question about it, throw it in the comments. I try and get to all of them, but it's hard to get to everyone. And also, if you want to hear about future videos regarding extremity problems, hip problems, lower back spinal related problems, subscribe to our channel and turn on the notifications so you know that we're getting the videos being dropped. Have a great day.